say, do you understand the gap you're standing in? And it brings me to tears every time because I see it now. I see, if you just think about what your own dental insurance would cover in 1 year, you know how limiting that is. So, their public aid in some states, they can't even have public aid if they're not a mother. So some states have some access to dental care, but what we're able to accomplish during their residential stay in these programs is life-changing.
So welcome to Amplify the Kingdom podcast. We are so excited to have two incredible women with us here today, and we can't wait to hear more about your mission and vision, because what you two are doing is really incredible. We want to be able to share that with the world. And so we have Denise and Dr. Jess with us today. And so if you want to start out and just tell us a little bit about your organization and how it got started and the heart behind it.
Sure. So Dr. Jess, myself, and our partner in crime, Marcia, we started Foundation 922 about 2 years ago now. And we are on mission to provide compassionate dental care and healing for women rescued from human trafficking and exploitation. And we envision a world where rescued women are restored to dental health as they continue on their journey through rehabilitation. So this all got started when Dr. Jess and I were approached by an organization in our community that rescues women from human trafficking and exploitation. And they had a resident in dental pain, and they asked if we'd be willing to help. And I thought for sure Dr. Jess is going to say yes. And I went and I asked her, and she has had an overwhelming yes, and that great smile she has. But she and I had both, and Marcia, volunteered at a nearby clinic at a church. And Dr. Jess was familiar with the program that I was speaking of, and she had already seen patients from this residential program. And so for a number of months, Dr. Jess was caring for all of the dental needs of the residents of this program. And she said, yes to this patient I brought to her, and all of them after that. And it went on. And Jess said, Denise, every patient that I see, pretty much every patient is a recovering addict, and they have extensive dental needs. And I would love to see them, be able to have more than just their emergencies taken care of. So why don't we start a nonprofit and do that? So we did.
I love it. Let's just start a nonprofit and do it. I love it. So Dr. Jess, tell us a little bit about your heart and what you're excited about with this mission and vision.
Well, I love the direction it's going. We're able to help so many women, so many more women since we started the foundation and made it official. By making it official, we've been able to add many general dentists and providers and one of every specialty. So we have endodontists and oral surgeons and periodontists on board, all because when I was treating these women just on my own solo, there were occasionally needs that I couldn't meet them because situations that were maybe more complicated that I was not comfortable treating, or different things that I'm not a specialist, so I would have concerns over them having that proper care done. And so really excited that we have so many professionals on board that are willing to donate their time and help with our mission. And I'm most excited about that, really. I'm really looking forward to being able to expand. And, I think our goal and my goal is to have dentists in every state that has the programs that are rehabilitating. Years in, and that's a big reach goal, but I do want to be able to be in every location that is helping these women get back on their feet.
I love that. I love that. So can you give us an example without naming names, because we know this is very confidential,
of course.
Work that you do is very confidential. So can you give us an example of a story of a woman that you helped? Maybe each of you can give a story.
Well, I was volunteering at the church dental clinic at the time. It was 2017. And they had approached me that morning and said, a woman is coming in. We specifically want you to see her. Here's her background. This is what's happening. And I was blown away by that. And I just was like, absolutely, I will do everything I can to help her. And when I met her, it was just an incredible instant connection I had with her. And she was very scared. She was crying. She was in pain. She was, I think, 3 weeks or 4 weeks into the program. So very newly sober, very newly in the program, working every aspect of her life she was working on. But then she presented here with pain and an abscess. And so, but very afraid of coming to me and of hurting more and all the concerns that most people have. Right. So I treated her that day and I said, I want to take care of you. So, I would be very willing and happy to see you back at my office, because my office is very small. It's quiet, it's private, it's all women. And, at the church care center, which the church care center is a huge blessing and it's amazing, but it's big and it's busy and it's a huge parking lot and it's loud and there's, people of all, kinds. And, I think when you're very newly working a program and very newly in this new life that these women have, I just wanted to protect her and I wanted to take care of her. So for my post-op exam, I just had her back to my office and then we developed a treatment plan. And I said, I'm just going to take care of you. And I got her to kind of a level of baseline healthiness with her teeth. I mean, she had some big issues for sure. In long term, restoring her, I knew it was going to be a bit of a process. So but that was kind of the start of it. And it's neat hearing her testimonial from her standpoint. Hearing it from her standpoint is pretty incredible. And you can't listen to it without tissue. It's really, I watch it now. I watched it so many times, and I'll watch it sometimes and just be like, oh, she's so incredible. Like, she's an incredible human. And so it just made me want to do more. And since I've had many patients where, it had such severe infection that they were on their way to being septic in their body, and seeing some of the infection and it just shocked me that they were functioning and living life with the amount of infection they had present in their mouth. And it translates through, if you're carrying that infection, that nothing else heals well, and you have inflammatory factors in your whole body, and it really truly makes people sick. So being able to take care of that is really, it's really the whole mission of starting the foundation, is just to be able to do more of that. So
I love that. And we'll get to yours, Denise. But, I think it's so incredible because it's great to help people anyway. But then with these women who have been through so much, be able to help these women and see them blossom, I think that is so inspiring.
Yeah, it's the best.
It's
the best thing. I feel very privileged that I can do that for them.
That's amazing. Thank you. And how about you, Denise? Do you have a story that sticks out in your mind?
Gosh, a lot.
I know it's hard.
I don't get to be with the patients as much as Dr. Jess does, but I do know the patient she's talking about pretty well. And I have gotten to see her journey, and it has blessed me. But as far as the story goes, for me, I've just really seen God work in the details of the foundation. And that's where I'm more involved, is directing the program and marketing our program, fundraising our program. I am part of recruiting these doctors that have joined our team. So the story for me is all the Lord and just watching him work. I've become addicted to seeing him move in our foundation. When it came from that first phone call and that first question to Jess, where she said yes, and just watching all of us answer a call that God put on our hearts to use our God-given gifts to bless someone. I think that all of us have been in dentistry well over 20 years, and we just feel equipped and ready to help someone at this stage in our career. So I just think God's timing is so perfect always.
God's timing. And that's, we talk about that all the time. I didn't mean to interrupt you, but
It's
we talk
okay.
about that all the time.
Yeah.
And the people that have been put in our paths since we made this official, that we say just, that was just God putting them in our paths. And it like, I get chills even thinking about just all of the people that have been so excited and willing to help, and not even just financial donations, but all of it. All of it. It's, I mean, the things that we've done so far to bring awareness to what we're doing, it only because of all the people that God put in our path, and just, it's, and then Denise will, she's humble and kind, but I will tell you something. She's incredible. When she tells the story of our foundation, you know, at all the events we have, she always has a kind of an introduction, you know, she kind of talks, and I could just listen to her talk for hours about it, because she's just so articulate, and the way she describes what we're doing, it just speaks to people, and it's pretty incredible. So I think that's what's fun for me to see, because when I started this, and I say I'm just a good dentist with the heart. You know, I didn't know anything about starting a foundation, like nothing. I contacted the attorney. I said, we're going to do this all the right way. Let's, you know, she's like, do you want to be tax exempt? I'm like, I don't know. Do I? You know, I literally didn't know anything about a nonprofit, and didn't know anything about what we have to file to the state and all the things. I was like, I just want to do this because we're going to help more people, you know? And so Denise came along, God put her in my front of my mind, and said, no, Denise is going to do this because she is incredible with all of those details. So, you know, I'm the dreamer and the, you know, crazy dreams and thoughts, and Denise helps me put them into play.
You know, I love that, because
Yeah.
you know, it's so inspiring for other women too, to see this, where you have an idea, right, but you don't know how to do it, and God brings the right people into our
Mhm.
lives to partner with us.
Mhm.
He does the work. We
Yeah.
just have to agree with him, right?
Mhm.
Right. And that's really what the journey has been. When you said what, stands out to me, it's just there's so many people that have said yes, that I would just be praying about something like, the first thing that we needed was another general dentist to join us, and the Lord provided her. And then if Dr. Jess isn't incredible, so is our other general dentist. Like, they're both just
Our
so
general dentists are so
they're
amazing.
outstanding. And they have led us to the next specialist and the next
Mhm.
person, and everybody's heart has just been, it's been called. And I've had some doors closed, but some other windows have been blown wide open when that happens. And so, but yes, what's happened for me that blows my mind is we started with one program in our community, and then we have grown in our first year to serving 3 homes. These are programs that rescue women from human trafficking and exploitation. They have a residential program where they minister to their addiction needs, grief counseling. We care for their dental needs. They have their medical needs met there, and they have supervision in the residential home to just learn basic skills like cooking and cleaning, because a lot of these ladies have never even had a bed, we've been told. So we're just the smallest part of this journey, but each program that we partnered with has a little different model, but what they all graduate with between 1 year and 3 years is what we're learning is they get to have some sort of resume too, because the ladies will be restored not only spiritually, mentally, and physically, but they get a little bit of job experience. And then they can graduate from these rehabilitation programs with some skills on a resume to go out and not only just their teeth restored, that's the vision, is when they're in these programs, how much can we accomplish for their teeth while we have the ability to work with them. And then just from that first year now on to our second, we've partnered with our 4th safe house in our community, and that escalates. We had the capacity. Each home rescues about 6 ladies during their residential stay. They can have a capacity for 6, and this new program has the capacity for 21. So we have the hopes in 2025 to serve almost 50 ladies is what we're looking at. And so we've been praying and asking God, like, show us how to do that, Lord. Like, what does that look like? And in that time, we had 3 root canal specialists join us and 2 new general dentists. And, we continue to seek grants and funding so that we can cover the costs. That's what we do at the foundation, is All of our dentists are
Mhm.
volunteering their time and talent, but we're just covering the costs for the supplies and a little portion of the overhead to just carry the procedures out. And so I just watch God work and I sit in awe. And they say in the Bible that God chooses, the least of us to accomplish his will. So it's clear that he's equipped me to do it. And I would say I feel like he has blessed me all along the way. So, and honestly, Jess and I have gotten to work together, I don't know, 6 years ish.
Mhm.
And I'm honored to just get to be so close to her because
Well, and
part of the
yeah,
fun.
that's a whole nother story in it of itself, how Denise came on board, but it's all part of the plan. And it's just amazing when I sit and look at the history and how many years we knew each other and worked together before this even happened. And yeah, it's just interesting. It's amazing to see what God is doing in our, in our lives, in our community. And
I love that. Is there anything else you want to share about your organization that you think people should know?
Well, sure. We have a long-term dream here, and it's actually turning into the short-term dream as we continue. But our short-term goal was, okay, in our first 1 to 3 years, let's figure out how to do this. What does it look like? And I think we're starting to master that. But God has already spoken on our hearts about moving to the next state. Because what I do want people to know is there is no program like this in the United States. Before we started, we had to do our research. Like, okay, what other opportunities are available to rescued women rescued from human trafficking similar to your program? And there isn't one. And so when we meet with these program directors of all the houses we serve, they say, do you understand the gap you're standing in? And it brings me to tears every time because I see it now. I see, if you just think about what your own dental insurance would cover in 1 year, you know how limiting that is. So, their public aid in some states, they can't even have public aid if they're not a mother. So some states have some access to dental care, but what we're able to accomplish during their residential stay in these programs is life-changing. And so we want to see those types of life-changing events happen throughout the country. We feel that God is calling us to do that. One of the homes we serve has 12 houses throughout the United States, and I'm sure that's not the only program. And so what I'd love people to hear is, if you feel called to this ministry, to support it by prayer, to support it by way of just connecting with us online and just getting involved, reach out. Renette's going to share some information on how to do that, but just pray that God would lead us to what the next step is, because we do envision this being across the United States.
I love that. So if you are listening to this and say you're in the dental field and you feel like your heart's tugging, like, I want to do something like this, or you're somebody like Denise who feels like they want to start something like this in their state, how can they do that? How can they can contact you and you'll walk them through that? Is that
Well, it would definitely be more than that, but it would be, if you just feel like this is something you want to learn more about, you can contact us on our website. It's that when you go onto our website, which Burnett will list, you can see our email and reach out, because it will be more of a calling as we branch out. But just anybody that's interested in learning more, and even programs that exist outside of Illinois, I'd like to know about that too. But yeah, that's where we're at.
I love that. And so, yeah, we want to be able to let people know that if they're inspired by what you're doing, that they can join you. They can, I'm sure you always take donations, right? So if anybody feels their heart tugged in any way, just to reach you, and we'll post all the information below, your website, your email, and then any social links that you have, we'll post below this video. And then also, if you have a question or something you'd like to share with either of these two sweet women, just post that below in the comments too, and we'll share that with them. Because our heart really is to amplify these amazing stories and what God is doing. And something as simple as, people might think, oh, getting your teeth fixed, which might be a simple thing, but to these women, it's a big thing. And
it's a huge thing.
it is. And I think this is just proof too that this is marketplace ministry, right? Where you serve where you're called. And I love that we're both doing that. You're serving where God has called you. And I think that's so incredible.
Thank you.
Thank you.
Yeah. So, is there anything else you'd like to share, a special story or something on your heart?
Hmm. No, I think I've shared my heart pretty
Mm,
good.
yeah, I think so too. Yeah,
Yeah.
I think when, talking about what I'd like people to know, you
Hmm.
know, so I mean, some people think teeth are optional, or, does it really matter if we fix their teeth, but when it comes to restoring these women's dignity, in order for them to present themselves to get that first job, they have to have some teeth. And a lot of these women have lost teeth due to abuse and trauma. It's not just they weren't taking care of their teeth. And that's something I see repeatedly in these women. Sometimes we see abscesses just because, okay, they had a cavity that didn't get taken care of. But I would say a lot of what I see and do is due to the trauma of their past. And so to be able to give them back something that's going to function and look nice, and it goes a long way in restoring how these women are going to live their lives after they get out of their program. So I feel so strongly about restoring that. I mean, obviously initially I feel strong about restoring infection. That's a big thing that we have to treat. But when it comes to restoring their smile, it's amazing to be able to give them their confidence back. So that's something that I feel like, no one else, other like clinics, dental clinics and things like that, public aid clinics, they don't do that stuff. And so when it comes to that, that's such a rewarding thing to do. And I just want
I
to
love that.
let the world know we're able to do that for these women.
Thank you so much. I just love what you do. And they get a little bit of Jesus too. I love that.
Oh, absolutely.
Yeah.
Absolutely. And I believe that all the programs that we serve,
Mhm.
and not that, if they're Buddhist and they come in, I don't care. But I believe they're all Christian programs, aren't they? So, these women are, they're restoring themselves through Jesus, and they're,
Love that.
it's incredible to see that transformation as well. So
Hmm.
And I can't wait till 5 years from now, just the stories that there's going to be told, right? From these
I
women.
hope,
And it's
yeah,
going to be just incredible. Well,
I
thank you
hope.
so much for taking the time today. Again, I love what you
You
do.
too. Thank you.
And I
Thank you for letting us tell our story. We really appreciate it. I appreciate it.
Yeah, well, we need to get this story out there. So our heart is to amplify. So if you are a woman and say you're involved in the human trafficking and you hear this and you want to get help, how can they do that?
I've shared with Renette some resources she can put up if you are involved in human trafficking and you're looking to become a resident of one of the programs that are available. Renette can list those for you. And some of those programs, I believe, are throughout the United States. So you could look into those pieces of information.
And I do believe, I mean, if someone is in another state and doesn't know what to do, even if they come through this podcast and go through our links,
Mhm.
the people that are here in their programs would be able to guide them, I believe.
Yeah, that's very helpful. Thank you so much. Again, I love your hearts and I can't wait to see in 5, 10 years all this incredible stories that we have here. Yeah.
Thank you.
Thank you, Renette.